Thanks very much, Joanne. And I think this is the second time this week that I followed in Bill's footsteps. So it seems to be a great one, too, at least number one. I'll try and be brief, but I think just a couple of things in this context in terms of what the bank is doing and what we see, I think, a huge opportunity. The first is we think it's really important to change the discourse, a little bit like Bill was saying, but more fundamentally to recognize that health and education are not charity sectors or consumption sectors from an economics perspective. They're actually sectors where you invest and you see fantastic returns to that investment. And that's not based on wishy-washy sort of we invest in everything. No, it's actually evidence over time, which should suggest that those countries that do invest in people, their health and education, they grow more quickly and more sustainably. And if you think to the future, what's going to sustain and help you navigate your GDP into the future if you don't have a well-trained, bright, healthy workforce that doesn't fall ill prematurely from chronic diseases as the foundation of that growth, then you're going to be in trouble. So we're really pushing on human capital as an institution and changing the discourse from doing this once you achieve growth, but rather doing this as an antecedent to growth. Having said that, within the health sector, we're unabashedly promoting universal health coverage. Why? Because in every system that has universal access, markets actually are doing much better in health and in education. And that just makes common sense. If you're delivering to 100% of the population, that is a much better denominator than delivering to 10%. And so managing the mix of margins and volume related to those markets, we think is more attractive when everybody is covered. It also corresponds well with our mission, which is to make sure that those with the greatest needs are beneficiaries of opportunities. But in terms of specific market opportunities, I just wanted to identify three that I think might help in terms of moving this to some practical opportunities, at least in the health area. First, we have this opportunity for changing the way we do procurement. The managed equipment scheme has been going on. It's quite attractive. Instead of retailing equipment on a facility by facility basis, if you issue tenders system-wide, you get and pay based on delivery and functional operation of that equipment. It makes a huge transformative difference. And we've seen in Kenya, you go from equipment graveyards to places where, in fact, the ultrasounds, the imaging equipment, the laboratories are working at scale. So there's a fantastic opportunity. We already have entry points. Other countries are signing up in Africa. Can we accelerate that and so that every country could potentially be a beneficiary and do it in such a way that private sector has a great opportunity to compete for those tenders? Second one, less well understood, but one where brings health and education together is the whole market for training health professionals. If you look what's happening in a de facto way, the private sector is moving in very quickly. Why? Because the public sector is sclerosed and not doing anything, and particularly in higher education. But what's holding back that market are a whole set of opportunities related to accreditation across countries, which would allow the private sector entries to achieve a recognized standard and really make a difference. Third area, and this is, I think, the biggest one from my perspective, and it links a little bit to Bill's comment around social health insurance. The primary form of financing, unfortunately, in most African countries and low middle income countries today remains you pay when you're sick. And if you pay out of pocket when you're sick, you're basically squandering resources. And every lesson in health and economics is that you prepay and pool, either through the public or private sector or some combination. So how do you harness that 600 million? If you look what's happening in Kenya with M-Pesa, health wallets, M-Tiba, great example. There are other experiments brewing, brings in the telecoms, mobile banking. It's a great private sector engagement opportunity, and one where if you harnessed 25% of the $600 billion, that would be 5 times total development assistance in health. Okay, $150 billion, right? So $30 billion is what is current development assistance. So if you look at that as a market opportunity, we really need to be collectively thinking about how to seize it much more systematically, which brings me to my last point.
Sorry, Tim.
My last point, okay? Which
I'm going to
is,
start walking towards you.
which is, if you don't nurture these markets, they won't necessarily emerge quickly enough. And I think some of the investments that we need to make, which are public sector investments in terms of standards, regulatory regimes, accreditation, doing those either country by country or regionally, are great investments. Making sure that countries have the capacity to manage private sector partnerships in the public sector, and making sure that there's veritable monitoring and evaluation to know what the real value added is in terms of better delivery, cost efficiency, et cetera. Those are public good investments that actually allow markets to grow and be sustained on a much more fundamental basis. They're very modest investments, but ones that, if they're done well, I think can help unleash a lot of the opportunity I think people here would like to see. Thanks.
Thank you so much,
Sorry.
Tim. Thank